Hey, this is Rick Kasalich, injury specialist from exercisesforinjuries.com. In today's video, I want to go through a few safe and effective knee strengthening exercises that you can do after ACL surgery. Now, Jenna's going to demonstrate them. I'll kind of talk about the details, and Jenna's going to go through the first one. Good. So the first one is a growing stretch. So how this is broken down, so you're standing nice and upright. What you're going to do is place your weight on one leg. You're going to bring the opposite knee up, bringing it out and back down to the start, up, out to the side, and back to the start. Now, if you're not able to stand, as Jenna's done there, you can go up against the wall, and that'll remove balance from things, and then you can go through the movement again. Good. Eliminating balance. So looking at the sets, reps, time, and intensity for this exercise, sets would be 1, repetitions would be 5, time would be smooth, controlled movement with a quick stop at the end position. Intensity is light. This is like a dynamic stretch that we are doing. And kind of the purpose of this exercise is a lot of times when it relates to ACL surgery, we have tightness in the hips. So we're loosening things up with this movement in the hips. And secondarily, when it comes to bringing the knee up and then out to the side, we're working on flexion and extension of the knee. And then the ACL surgery knee, when you place your weight on it, you're having to activate the muscles around the knee and around the hip. Now, if you're not able to stand because it's too advanced for you, you could also do the exercise on the floor, and we'll quickly demonstrate that. So you can lie on the ground, so you're offloaded. You can end up bringing the knee up, out to the side, and then back to the start. So bringing the knee up, out to the side, and back up. Okay? So if you're not able to stand on it, if your surgery was quite, it wasn't that far long ago, or if you don't have the strength quite yet to go through that exercise. So we've kind of shown you like 3 different options for that first exercise. Now, I've gone through the sets, reps, time, and intensity, and kind of why we're doing it. Now moving on to the second exercise. Now this is like a partnered hamstring hold exercise. So we'll just go through it and then, okay. Okay, good, and relaxing. Okay, so with this one, you're lying on the ground. You're going to bend the knee, and then what you want to do is you want to activate the hamstrings and bring the heel, other direction, this way. Okay, okay, and then relaxing. And you want to mix up the angle. So we've gone at 90, which is a common angle that people will go to. We can decrease. Okay, so I'll get you to relax, and we'll go a little further. Okay, we'll go from this angle. So you're activating the hamstrings and relax. Okay, good. And again. Okay, good. And relax. And again. Good. And relax. And now we can kind of go to 45 degrees, and then same thing. Okay, good. And relaxing. And again. And relaxing. Good. Now, if you don't have someone to kind of go through that exercise, what you could use is you could use some resistive band to go through the exercise, or another way is it won't be able to demonstrate here, but you kind of lie on your side and you're pushing up against the wall. So you can utilize the wall to go through the exercise, and you can change up the angle within the knee to really activate and work the hamstring. Now looking at the sets, reps, time, and intensity for that exercise that we just went through, sets would be 1, repetitions would be 5, and I'd really try to mix up the different angles that you're at. A lot of times we'll deviate to the angle that we're strong at, and what we want to work on is on all the angles, especially the angles that we're weak in. Now looking at the time, I got Jenna to kind of contract the hamstring, not at maximum, but looking at like 50% to 75% for about 2 seconds. And then you can progress that to up to 5 seconds. So sets, reps, time, looking at the intensity, I've kind of mentioned it. You're looking at contracting that hamstring about 50% to 75%. Now the purpose of this exercise is to activate the hamstrings, really work on activation, endurance, and strength of the hamstrings, because when it relates to an ACL injury or post-surgery of an ACL, a hamstring plays a big role when it relates to recovery and prevention in the future. So when it relates to your hamstring, a lot of times they will assist in the stability of the knee and kind of compensating for that ACL, either if you have lacked the ACL or will assist in the future if you've had an ACL surgery to prevent anything from happening in that knee. Okay, so we've gotten through two of them. Now moving on to the third one, hip abductors. So with this one, you're standing nice and upright. You're putting hand up against the wall. You're going to bring the leg out to the side and back down, and then out to the side and back down. And then so with this one, when you're bringing the leg out to the side, you want to look at going at about 30 to 45 degrees. So maybe I'll get you to face this way, and you can kind of show how far out you're bringing the leg. Okay, good, right to there and back. And the reason why is we don't want too much movement happening in the pelvis, and we really want to focus on that outer part of the hip. Perfect. So looking at the sets, reps, time, and intensity. Sets are 1, repetitions would be 5. Time, smooth controlled movement with a good contraction of the outer hip at that end position. Looking at the intensity for this one is light because we're really working on activation, endurance, and strength of that outer part of the hip. And the purpose of this exercise is we want to work on strengthening the hip and strengthening around that knee. And it serves two purposes. So looking at the post-surgery knee, when you're bringing the leg out to the side, we're working on that outer hip, which is important. Strong hips help when it relates to recovering from the knee. Now, when you're weight bearing on that leg, we're working on strengthening the muscles around the knee and also strengthening muscles around the hip. So that you're always working on rehabbing that knee no matter what that leg is doing. So that's the third one. Moving on to the fourth one. Okay, a static lunge. So breaking it down, so Jenna's standing nice and upright. She's going to take a big step forward, holding that position, bringing that back knee down. Perfect. And then I'll get you to face this way. Good. Taking a step forward. Good. So she's 90 degrees in the front leg and then looking at 90 degrees in the back leg. So the front leg, we're really working around the muscles around the knee, and looking at the back leg, we're really working on the glutes and the hamstring. Perfect. Now looking at the sets, reps, time, and intensity. Sets are 1. Repetitions would be 5 on each side, so 5 on one, 5 in the other. Time, smooth controlled movement with a good contraction of the muscles around the knee and the glutes and the hamstrings at that top position. Looking at the intensity, the intensity will be light to moderate depending on how strong you are in that post-ACL surgery knee. And the purpose of this exercise, we're working on strengthening the muscles around the knee, and we're also working on strengthening the muscles around the hip. Now, with that exercise, a couple options that you can do. I'll get you to stand right here, Jenna. So sometimes what people will find is if they step into a back lunge will be easier if they step into a front lunge. So if it's sore, difficult going into a front lunge, then you go into the back lunge. That tends to be easier when it relates to the knee. Other things is if the balance or stability kind of bothers you, once again, we can move to something like the wall, and you can step back and you can kind of eliminate balance with the hand. So you're really focusing on having a good, perfect movement and good, contracting the correct muscles and doing the exercise correctly. Now moving on to the 5th exercise. 5th exercise, 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 5th Okay, good. So it's a single leg half squat. So what you're doing is you're standing nice and upright. We're going to put the hand up against the wall or something stable in order to remove balance so we can focus on doing the exercise correctly and targeting the right muscles. You're going to stand on one leg, then you're going to bend in the hip and bend in the knee, and then back up, really contract the muscles around the knee and around the hip to get to that standing position, and then coming back down again, bringing the hip back, bending at the knee, good, and back up, good. And then I'll get you to face that direction, and I'll get you to go through a couple repetitions. So we're really trying to keep that pelvis square when going through that movement. Good. And back up. One more repetition. Good. Perfect. Now looking at the sets, reps, time, and intensity. Sets are 1, repetitions would be 5. Time, smooth controlled movement with a good contraction, the muscles around the knee and the muscles around the hip, specifically the glutes and secondarily the hamstring at that top position. The intensity will be light to moderate, depends on how strong you are in the hips and the knee. And the purpose of the exercise is to really start getting you into that squatting movement, retraining the knee to work properly in that squatting movement, activate the muscles around the knee and activate the muscles around the hip. So there you go. Those are some safe and effective knee strengthening exercises that you can do after ACL surgery. Now, if you want some other best tips and tricks when it relates to overcoming knee pain, which will help you if you have ACL surgery, then what I recommend you do is click right here. I have a brand new free report called 5 Tips and Tricks That Fight Knee Pain and Tightness. Just click right here. Let me know where to send you that report, and I'll send you that report right away. Now, if you're watching this on a mobile device, tablet, or smartphone, head down below in the description and click the first link, which will be exercisesforinjuries.com/knees. Let me know where to send you that report, and I'll send you that report right away. Now, if you got benefit from this video, make sure to like this video. If you have a question or comment for me, leave it down below in the comments section. And lastly, hit subscribe to get future pain relieving videos.